So let me get started. I should say thank you, Leanna, for chairing this California event. And I should also say that we're having a similar event tomorrow in Austin, Texas, that's hosted by the LBJ School, which seems like an appropriate place to talk about healthcare. This is the National Coalition. You get some idea of our membership. It's payers, providers, health plans, consumers. And the one thing that we're all concerned about is healthcare affordability. And the concern is that we are on an unsustainable path. And so I'm going to try to illustrate that very briefly. Some of this I think you must be familiar with. When we talk about total healthcare costs, the trend is outracing our ability to pay. It's outracing growth in our economy. It's outracing inflation. And it's a system-wide issue. It's not confined to any one piece. I was part of an Institute of Medicine study group that looked at the issue of waste and unnecessary care in healthcare. This was a few years ago, so the numbers have changed, but not the proportion. And we found that waste was endemic across the board in healthcare, not just one area, but covered administrative waste and unnecessary care, excessive prices. A very thorough report concluding that about 30% of the dollars we spend in healthcare did not improve health. In other words, was unnecessary or wasteful. So that's a huge number, and it certainly gives us plenty to go after. But there's no one single solution. There's not a magic bullet. There's not an easy way to deal with this. So we know that when we look at healthcare and we break it out, we see that the costs are spread mainly in physicians, but hospitals and hospital services and pharmaceuticals, but really across the board. We know that in the private sector, premiums have been growing very aggressively, and that employers are shifting more and more of that cost onto the employees as well. So we see the premium growth being pretty aggressive. I'm sorry to race through this, but I hope that you'll have ability to go back and look at these if you're interested afterwards. But the one big consequence of the premium growth is the rise in high deductible health plans. And that's fueling a real change in public perception of the cost of care, because now people are confronting the fact that when they need care, they may be liable for thousands of dollars out of pocket, meaning that for many people, having insurance is no longer a guarantee that they'll have access to the care they need when they need it. We know that deductibles have been increasing dramatically. And we know that this also is taking place not only in the private sector, but also with the federal budget. We have a compounded increase in federal spending on healthcare. Some of this is a function of demographics, but most of it to date has been increases in the per capita cost of services. So if we look at the average American family of four, under 65, about $60,000 a year median income, but health costs eating up a very substantial chunk of that. And again, the question is, what's affordable? I think that this headline probably captures it as well as anything, that the last decade in terms of health cost growth has basically negated any increase in productivity or wage increases that the average family may have had. So we've had stagnant take-home pay as a result of growth in healthcare costs. One Predictable result of all this is access problems. A very large number of Americans, again, even with insurance, now reporting that they have trouble financing care when they need it. California is no different. Sometimes you think of California as almost a separate economy on its own, but here we see the average cost growth in California is 5.7% a year, much higher than the growth in the economy, much higher than the growth in wages. Medi-Cal is a very substantial part of public growth in California. You can see, though, that most of the cost is federal, but still a very significant part of the California state finances. And when it comes to drugs, more and more of our healthcare dollar is going to the very high cost drugs, the biologics, that offer real promise, but also are priced often at over $100,000 a year. And this is really the future of drug development. We're seeing more and more extremely high-cost drugs coming onto the market, and that's going to drive pharmaceutical spending to new heights. So here's another example of what we're seeing just with pharmaceutical costs. And I just need to say, you know, pharmaceutical costs by themselves aren't necessarily a bad thing if they keep people out of the hospital, if they keep people well. But that doesn't seem to be what's going on. So that's a concern, that we're spending the money, but we're not necessarily getting the return in terms of reduced costs in the rest of the system. So retiree benefits are growing. I think Leanna could tell you a lot more about that, and probably Kathy will a little later on. And we also know that much of healthcare today is driven by the prevalence of chronic conditions, multiple chronic conditions. So the typical shorthand for this is the top 5% of the sickest patients, those with multiple chronic conditions, account for about half of total spending in any given year. And so the nature of disease has changed over the last couple of decades from acute to chronic, yet we don't really have a healthcare system that's been responsive to that. So again, the purpose of today is to lift up some strategies that are promising, that have potential, and that we can adapt nationally. And we're looking for those ideas from our presenters and from our panelists. We're also looking to be responsive to the whole range of cost drivers, not just one. So we have to take them one at a time, but we're not going to be successful just looking at one part of the problem. We've got to look at the whole situation from a person-centered perspective. That's hard to do, but I'm hoping that we can come out of today with that kind of perspective. So I know that was quick, but I just wanted to set the stage. And now let's get to our presenters. Let me just briefly introduce each of them and then ask them to come forward and take their seat on the stage.